Okay, I will run a short movie with the ENSP last brochure on tobacco and cancer.
Cigarettes can kill you. All you do is inhale and exhale.
So good afternoon again to everyone, and welcome to our webinar. And for the beginning, I will give the floor to Dr. Francisco Rodriguez Lozano, the ENSP president. So please, Francisco, the floor is yours.
Good afternoon, ladies and gentlemen. Welcome to this webinar organized by ENSP. ENSP is the European network which integrates 71 national organizations on tobacco control, smoking, and treatment. It is spread through 38 countries, 22 of them belonging to the European Union, and the other 16 to the WHO European region, covering approximately 750 million citizens, and being active since 24 years ago. Next year will be our silver anniversary. Ending tobacco epidemic in Europe. Tobacco is still the leading preventable cause of cancer in Europe. We will devote this afternoon to the Europe's Beating Cancer Plan, which has been recently launched by the European Commission. All the 6 speakers will offer us their different and complementary perspectives on the tobacco-nicotine cancer relationship. Ending tobacco epidemic is nevertheless a public health concept that goes far beyond cancer, even though, no doubt about it, cancer is an important one. Today, we'll focus on cancer, which is responsible for a third of all the deaths caused by tobacco-nicotine consumption. But allow me to bring to light other health problems that, in those who smoke, significantly increase their mortality rates and remarkably decrease their life quality, like cardiovascular diseases, first cause of morbid mortality in smokers and vapers, respiratory diseases, psychiatric disorders strongly associated with nicotine consumption, osteoporosis, or cataracts in the eyes, just to mention only a few. The question is that to control tobacco consumption in Europe is absolutely critical. Although there has been an impressive improvement in comparison to the end of the last century, data shows that smoking prevalence in Europe has barely lowered in the last few years, and that a not inconsiderable amount of European countries haven't still implemented different tobacco control measures about which there is enough scientific evidence about their usefulness, about their cost effectiveness, and about their ability to decrease some of the social inequalities generated or increased by smoking. WHO has recently announced that in 2025, the European region will be the only one where smoking prevalence in women will not be lower than 30%. The implementation of different measures like plain packaging, funding of effective treatments, restriction on smoking in public places, restrictions on tobacco advertising, promotion, and sponsorship, as well as taxes and prices policies, vary greatly among different European countries. Even those countries which could be described as advanced in the implementation of the Framework Convention on Tobacco Control, the first universal treaty in public health, they still have wide room for improvement. There is also wide room for improvement on our countering of new and old tobacco commercial strategies from so-called big tobacco firms. To be able to avoid the new renormalization they are looking for, we have to be able to regulate adequately their new nicotine products without their interference, since most of these new products are in their hands, and they are eager to push regulations in the most convenient interests. And in the opinion of most tobacco control experts, this implies to regulate them mostly as we consider we have to regulate tobacco. There is not a huge difference between the old tobacco products and the new nicotine ones. The main difference lies in their commercial strategies. I think it is high time for the European institutions to take a new bold, daring, effective measures to improve tobacco control. It is high time for the European health authorities to ask their member states a serious commitment with public health through a tobacco control comprehensive plan, an overall strategy able to include all those actions which have proved themselves effective and able to decrease the gaps existing among countries and within each country among the different social and economic strata. The unfair, alarming high gaps in smoking prevalence that can be observed in those groups with lesser access to education, training, and health opportunities should not leave us indifferent and need to be also tackled. As I have previously said, today I will focus on cancer and tobacco. Regarding this, the plan announced by the European Commissioner Kyriakides just 3 weeks ago is an outstanding example. If we are able to achieve it, an European tobacco endgame will significantly reduce the damage caused by cancer in the whole European Union, and not only the ravages of cancers, but also those from some other diseases and disorders. The end of nicotine recreative consumption will lead to a noteworthy improvement in our level of wellness and in our level of health. In Europe, each year, tobacco is responsible for 700,000 deaths and accounts for an expenditure of 25 billion euros, cost only for the provision of health care. In addition to it, smoking causes a not so easy to estimate burden of pain and suffering, not only for the smokers, but also for their families and loved ones. We all who work on tobacco control are therefore going to support wholeheartedly this whole initiative. We are going to have now the opportunity to listen directly to 6 voices playing an important role in this field. Stella Kyriakides, Commissioner responsible for such an ambitious plan, Oksana Domenti, the WHO representative at the European Union, Anil de Cruz, President of the Union for International Cancer Control, Panagiotis Bekrakis, ENSP Scientific Committee President, Vlad Voiculescu, Minister of Health of Romania, and Antonella Cardone, Director of the European Cancer Patient Coalition. Each one, from their own perspective and professional expertise, will contribute to our perception on tobacco endgame as a strategy to reduce cancer. Even though politicians, as representatives of citizens, there is no doubt that civil society as a whole, and patients in particular, are the final recipients of those policies, and they should contribute to their elaboration. It is both fair and enlightening. As a health professional and as a cancer patient, not the only one in this forum, I support it and I can verify it. Thank you very much.
Thank you very much, Francisco. And what I propose you, in order to gain time and waiting for Commissioner Kyriakides, is just to offer the floor to Antonella Cardone, because here we were representing the NGOs on this table, ENSP and ECPC. And I kindly ask Antonella to address her speech to the audience. Please, Antonella.
Thank you, Cornel. So you know that now that I work, I'm the director at the European Cancer Patient Coalition. So at ECPC, as the largest cancer patient umbrella organization in Europe, we appreciate that the Europe's Beating Cancer Plan focuses on the well-being and of patients and their families, because we consider that patient centricity, together with the key actions such as the improvement of health literacy, reduction of tobacco use, equal access to medicine and innovation, will effectively tackle the cancer burden across Europe. And if we all work together towards the same goal, we can all together help revert the dramatic trend of cancer becoming the leading cause of death in Europe. You all know that now cancer is the second leading cause of death after cardiovascular diseases. So there is considerable evidence that shows the effects and consequences that tobacco consumption has on cancer. and the Europe's Beating Cancer Plan is a step forward in the fight against the tobacco smoke, specifically as a cancer prevention strategy. It is well documented that tobacco smoke is strongly associated with a number of cancers and not only lung cancer. Unfortunately, there is very little research on the impact of tobacco smoke on the promotion or distribution of the tumor in the body, and on the impact that tobacco smoke has on the treatment efficacy, on recurrence, toxicity, and mortality, and on the impact that tobacco smoke has on the value-based outcomes, like the cost of cancer treatment, quality of life, and productivity of cancer patients. These are all very important aspects to consider when managing cancer with a patient who smokes cigarettes. So the little available research shows that active smoking increases the susceptibility to common cancers in the general population, but also increases disease severity and comorbidities in cancer patients. In patients with cancer, continued tobacco use after diagnosis is associated with poor outcomes, including increased treatment-related toxicity, decreased quality of life, and survival. Evidence shows that cancer patients and their overall cancer treatment outcomes would benefit significantly if the patient quit smoking. $3.4 billion are spent annually on cancer drugs from treatment failures due to tobacco smoking. The entire economy would benefit from smoking cessation programs, and yet up to 50% of patients smoking before a cancer diagnosis continue to smoke during treatment, and the relapse rate is very high among those who quit. So smoking cessation interventions should be a relevant part of the standard oncologic treatment and could involve individual counseling, hospital or community-based programs. So the take-home messages from my intervention here are the following. Like, quitting smoking at diagnosis can improve cancer patients' treatment effectiveness, overall outcomes, and the quality of life of cancer patients. Cancer diagnosis may provide a useful turn point moment to support cancer patients to quit smoking. But this chance is frequently undervalued by the healthcare system. Inclusion of smoking cessation programs into standard care for cancer patients is too often overlooked, and there is a lack of support for cancer patients who are willing to quit. So the implementation of the Europe's Beating Cancer Plan should adequately addressing cessation. So to conclude, the Commission's plan indeed confirms an ambitious tobacco targets as part of its push to contain cancer mortality, with the goal of creating a tobacco-free generation by 2040 and less than 5% of the population tobacco user by 2040. At EasyPeasy, we're pleased to see that the fight against cancer remains a top priority for the European Commission, despite the unprecedented reach and proportion of the coronavirus health crisis. However, despite seeing that Europe is on the right direction in order to end the rising burden of cancer, effective implementation of the plan is key. And we, together with the entire cancer community, are committed to support the execution of the plan. Thank you, Cornel.
Thank you very much, Antonella, for this important message coming from the European Cancer Patients Coalition. And just I have to welcome Commissioner Kyriakides and also Minister Vlad Voiculescu, Minister of Health of Romania. They just connected to our important event. And yes, you mentioned the new European Cancer Beating Plan. Truly, this is a very important step, and I have the honor and the pleasure to give the floor to Commissioner Kyriakides to explain us a little bit the connection between cancer and tobacco in this new Beating Cancer Plan. Please, Commissioner Kyriakides, the floor is yours. I think we have a technical problem. Okay, let's wait few seconds. Okay. Okay. Maybe just a few seconds. Yeah.
Okay.
Okay, seems that now we have sound from Commissioner Kyriakides.
I think, yes, I'm trying to turn my video on just to...
Okay. Super.
Okay, I think I've joined you now.
Thank you. Welcome.
Thank you so much.
Please.
Thank you. So, ladies and gentlemen, it's a great pleasure to join you today to discuss a very important part of our joint action against cancer in Europe, but also beyond. No matter who we are, cancer will affect us at some point in our lives, whether as patients, whether as family members, as friends, or as relatives. We all very likely experience the very same sense of concern and of often pain that cancer provokes. But we are able to turn the tide against this disease, and we can do so working individually, but also by working together. And through our teamwork with our member states and EU institutions and patient organizations and health advocates like you, we have produced a plan for us to be able to change the face of cancer. A plan that goes into the 21st century, a plan that is for all Europe's citizens. Europe's Beating Cancer Plan is accompanying cancer patients and citizens during the whole cancer journey, from prevention, early detection, diagnosis, treatment, quality of life of cancer patients, of survivors, and of course, palliative care. Prevention and tobacco use, the leading cause of preventable cancer, are of course our focus today. Evidence shows that about 40% of all cancer cases in the EU can be prevented. However, only 3% of health budgets goes on health promotion and disease prevention. So there is a great deal more that we can do on prevention. And if we are able to succeed, we will be able to ease the pressure on our healthcare and social systems. We will keep our economies healthy and productive with a healthy workforce. And we will be boosting member states' efforts to meet global targets on non-communicable diseases. But most importantly, we will save lives. And in order to succeed, we must focus on vaccination, on environmental and behavioral risk factors, and that includes tobacco use. As has already been said, over 1/4 of the cases are attributed to tobacco use. With no tobacco use, 9 out of 10 cases of lung cancer could be avoided. Our understanding of how tobacco smoke damages our health has never been greater, yet the smoking rates within the European Union remain very, very high, around 25%. And now we see new products like electronic cigarettes, heated tobacco products, and nicotine pouches entering the market. In response, with Europe's Beating Cancer Plan, we're proposing bold and ambitious actions on prevention through the reduction of the use of tobacco. We have set a very clear objective to create a smoke-free generation in Europe, where less than 5% of people use tobacco by 2040. And to meet this target, we need to set our sights even higher. This means enforcing the EU tobacco legislation more strictly and keeping it pace with new developments, so that it can be up to date and can address the endless flow of new products entering the market. And this is particularly important in order to protect, of course, young people. We will start by reviewing the Tobacco Products Directive to make product regulation stricter, and the Tobacco Taxation Directive to increase tobacco taxes, and the rules on cross-border tobacco purchases. We will address advertisement in the area of tobacco, promotion and sponsorship in social media and online services. And we will also update the Council recommendation on smoke-free environments to emerging products such as e-cigarettes and heated tobacco products and create more smoke-free environments. We really want to try and make smoking as unattractive as possible and to turn our ambitions into results. But to do this, we need your support over the coming months and years, and this is crucial. Just as it has been crucial to our progress in implementing a WHO Framework Convention in Tobacco Control, a convention that the EU and its member states were instrumental in shaping. Of course, implementation has not been without challenges, but with more than 7 million people worldwide still dying from tobacco-related diseases every year, we need to rise up to these challenges. And we're looking to make the 9th Conference of the Parties in November a success. Every step, of course, is a step forward that is welcome, but we need to all work together in close partnership. And the same applies to Europe's Beating Cancer Plan. I know that in your network and your members are ready to support this plan. We are fully committed to it as a commission, and not only having put it forward, but also in its implementation. And I will be looking forward to working very closely with you in the next phase with a smoke-free generation clearly in our sights. And with that, I wish your webinar every success. And I really want to assure you that you have a close partner in your efforts in the Commission and in myself as Health Commissioner. Thank you.
Thank you very much, Commissioner Kyriakides. And really, I wanted to tell you directly that when you launched the cancer plan, we were very happy because we found in the cancer plan part of the ENSP statutes. The ENSP mission is to reduce the prevalence under 5% by 2040. We included this in our statutes in 2011. And finally, after 10 years, now we can see that this is a priority for Europe and for the European Commission. Thank you very much. Thank you. And now it's my pleasure to give the floor to another important stakeholder and partner of ENSP in Europe, World Health Organization. And we have today with us Dr. Oksana Domenti, the WHO representative to the European Union. Please, Dr. Domenti, the floor is yours.
Yeah, many thanks, Colonel, and congratulations for your leadership. So Dr. Francesca Lozana, Commissioner Kyriakides, friends and colleagues, ladies and gentlemen, it's an honor to speak here today and always a pleasure to join the event organized by ENSP, one of the most active regional civil society, I would say, civil society advocate for the world without tobacco. I see it is a great opportunity to come together with a shared commitment of tackling one of the key risk factors for cancer. Tobacco use represents an important public health issue worldwide, but particularly in the European and the WHO European region, where it has the highest level of use with over 29% of the population reportedly using tobacco. Worryingly, as we look to future generation, we see that tobacco use remains popular in the youth, as 14% of boys and almost 12% of girls between 13 and 15 are reported to use tobacco in the region. Tobacco is the single most preventable cause of illness and death in the world, with the latest research suggesting that smoking-related deaths globally has risen to 7.2 million lives annually, killing more people than AIDS, malaria, and tuberculosis combined. All forms of tobacco are harmful, and there is no safe level of exposure. Its use affects almost all organs of the human body, and lifelong tobacco smokers lose at least 10 years of life on average. The overall proportion of cancer deaths attributed to tobacco in our region is 27% for men and 10% for women. In men, 9 of 10 lung cancer are related to tobacco use. Along with significant burden on health, as it was already mentioned today, tobacco use also imposes enormous economic cost to societies, both directly from healthcare needs and indirectly from loss of productivity. The total economic cost of smoking is around $1.3 trillion per year, equivalent to 1.8% of the world's annual gross domestic product. Inequalities are key determinant in both the use of tobacco and cancer. 80% of the world's 1.3 billion tobacco users live in low and middle income countries. Inequalities are evident with poor access to health services, which often dramatically contributes to poor health outcomes. We also see that an individual diagnosed with cancer is a greater risk of dying in Eastern Europe than in Western Europe. Then these inequalities in access to health services between and within countries run deep both within our region and globally. But the COVID pandemic has affected both the resource-rich and poor countries, exacerbating the situation with shortages of cancer drugs, significant drops in cancer diagnosis, and reduced prevention on and tobacco cessation activities. This means that the poor die at higher rates. Tobacco kills up to half of its users, and the COVID pandemic has made a bad situation worse, with the economic crisis making it harder for many to adopt healthy behaviors or gain access to prevention and care services. Adding to this, early in the pandemic, WHO found that NCD services were disrupted in almost 70% of countries globally. In the European region, over 30% had partially or completed disrupted services. But even in the might of the worst health crisis in living memory, there is a ray of light. The COVID-19 pandemic has led to millions of tobacco users who wanted to quit. However, quitting tobacco is challenging, especially with the added social and economic stresses brought about the pandemic. Worldwide, around 780 million people say they want to quit, but only 30% of them have access to the tools that can help them to overcome both physical and mental addictions to tobacco. WHO has been a leading force with tobacco control and supporting access to health services, and have guidance tools and plans for political, strategical, and individual use. WHO and partners have also developed a set of new materials on continuity of care for NCDs during the COVID-19 pandemic, as well as tools and resources people need to make a successful attempt at quitting. The WHO Framework Convention on Tobacco is the first international health-related treaty to have been adopted globally. It outlines a number of evidence-based strategies to combat this global challenge, which will save lives, reduce the burden of illness and inequalities, and accelerate economic development. In order to meet targets, all countries need to accelerate tobacco control by fully implementing FCTC. To support scale-up of specific provisions of the FCTC at country level, WHO introduced the Empower measures, which are the most cost-effective and impactful of the FCTC measures. Let me briefly take you through these key Empower measures that all countries should be applying. Monitor tobacco use and prevention policies. Protect people from tobacco smoke. Offer help to quit tobacco use, as without cessation support, only 4% of attempts to quit tobacco will succeed. Warn about the dangers of tobacco. Enforce bans on advertising, promotion, and sponsorship. Raise taxes on tobacco. For example, as an increase of tobacco prices by 10% decreases tobacco consumption by about 4% in high-income countries and about 5% in low and middle-income countries. Despite this, introducing high tobacco taxes, as you know, is a measure that is least implemented among the set of available tobacco control measures. Globally, WHO has recently launched a year-long global campaign for World No Tobacco Day 2021, Commit to Quit. This campaign aims to support 100 million people worldwide in their attempts to give up tobacco through various initiatives and digital solutions. It will help create healthy environment that are conducive to quitting tobacco by advocating for strong tobacco cessation policies, promoting increased access to cessation services, raising awareness of tobacco industry tactics, and empowering tobacco users to make successful attempts to quit through quit and win initiatives. Cessation policies are still among the least implemented of all WHO FCTC demand reduction measures, and governments should recognize this unmet need and act on it as part of comprehensive tobacco control strategies. At the same time, innovation should be encouraged and mobile technology should be fully harnessed to improve access to large and hard-to-reach populations. WHO has set up the new access initiatives for quitting tobacco, which gives people, among other things, free access to digital counseling. WHO has partnered with companies like Facebook, WhatsApp, and Soul Machines to raise awareness and support tobacco users to quit with the help of chatbot or digital health workers. For instance, our digital counselor, Florence, based on artificial intelligence, helps people develop a personalized plan to quit tobacco and guide them to available mobile apps and the tool-free quit lines in their countries. Meanwhile, the Quit Challenge on WhatsApp provides signing up tobacco users with free message on how to quit directly to their mobile. Within of our 53 member states are party to the WHO FCTCs. And within this region, we have witnessed some of the greatest gains in the fight against tobacco in recent years. For instance, large graphic warnings on tobacco products are now in place in 60% of countries. Tobacco use is regularly monitored in 74% of countries. And tobacco taxes are at 75% or more of the retail price of a packet of cigarette in 47% countries in the region. The progress made showed that it is possible for countries to turn the tide. But the WHO European region is expected, as Francesco told in the beginning, be the only WHO region in the world to fall short of the SDG target, with only 6 countries estimated to meet the target of 30% reduction in tobacco use by 2025. Adding to this sad situation, a new WHO European region report published this month through a gender lens, Women and Tobacco, reveals that although tobacco use among women is decreasing overall, the rate is going down at a much lower pace than in men. And in some countries, it is increasing. To deal with this situation, there is a lot we can do. The WHO European Programme of Work provides the vision for health in the region for the next 5 years. This program has prioritized cancer, presenting it as a central focus on ensuring people can live healthy lives, including reducing the risk factors that cause cancer. Addressing this is critical, and we must redouble efforts to tobacco control, reduce alcohol consumption, and promote healthy diet and physical activities. This month saw the launching of the Pan-European Cancer Initiatives, uniting all towards better cancer control and prevention, and to enable policymakers to make the right decision to address cancer effectively. These initiatives has 5 areas: prevention, ultimately a political choice, early detection, access to all diagnosis and treatment, palliative care, and a focus on data. Our vision is bold but realistic. We strive to have a region where cancer is no longer a life-threatening disease and where dying from cancer is no longer accepted as the norm. Preventing and stopping tobacco use is a key component of these initiatives. Through these initiatives, we wish to strengthen collaboration and partnership, reinforce political leadership, engage youth and civil society, and to fast-track the WHO signature solution. These are cost-effective, evidence-based policies and measures accompanied by technical guidance and tools aligned with WHO expertise and resources to achieve real impact at country levels. WHO welcomed the commitment of the European Union to the health agenda, and we wholeheartedly support the European Union initiative on cancer, Europe's Beating Cancer Plan and Mission on Cancer. This month, WHO Regional Director for Europe Cancer Club has appointed Aron Andersson, a Swedish inventor with first-hand experience of cancer, as a cancer ambassador for WHO Europe, with a remit to raise awareness and mobilize and unite forces against cancer, including the tobacco control agenda. The European Union and WHO have a long history of collaboration, and the synergies between our priorities and the European Union priorities related to NCDs and cancer clearly shows we are all on the same page. We very much look forward to our continued partnership and cooperation around the EU initiatives, and let us be united against cancer. Let's strive to help Europe achieve the target of 30% reduction in tobacco use by 2025 and to ensure access for health services for all. This will take political will, it will take personal will, and it will take united efforts working together hand in hand. But today we have an opportunity to step up this fight, and we know what to do and have the tools to do it. Thank you very much for your attention. Over to you, Colonel.
Thank you, Oksana. Very impressive and very comprehensive and very motivational, your speech, really. Thank you very much. And I hope that all the participants will learn a lot of things about the WHO activities from your speech. Even for me, it was very interesting because I heard about new activities, and I'm very curious to follow the next activities. So now it's time to go far, far away from Europe, in India. And I'm very grateful to Professor Anil de Cruz, the President of the Union for International Cancer Control, for joining us this evening, night almost, in India. He is just out from the operation. He's in the hospital still. So please, Professor Cruz, the floor is yours.
Thank you, Cornel. Just give me a second till I share my screen. I have a few slides that I would use. Here goes. So good evening to everybody from Mumbai, India. I know I'm out of the EU, but I share the same passion as with all of you all of ending the tobacco epidemic and making an impact in beating cancer. I am a head and neck surgeon. I work out in India. Head and neck are the commonest cancers that we see. That's 1/3 of all cancers, primarily due to tobacco, and close to 50% of our cancers are tobacco related. But I'm here today to represent the Union International for Cancer Control as the president. We have a large presence in Europe. Many of our members are from Europe, and a lot of our efforts, though global, are focused within the European region and the EU. I thought I'll start with a few slides on what is the UICC. It's the oldest and larger cancer control organization globally. and it was established in 1933. We are headquartered in Geneva, and we have a team of about 45 staff who are based in Geneva. But our activities span 172 countries. We have over 1,200 members. Now, our members are member organizations and not individuals. So we've got presence across the globe, and it's a mixed bag of members. We have academic institutions, NGOs, various organizations. We have an official relationship with UN agencies, the WHO, IARC, and IAEA. We have consultative status with the ECOSOC. We have more than 50 partners, including various cancer organizations, corporations, and foundations. And we've been founding members of 4 very large organizations that have subsequently branched off and do a lot of work in cancer control. The NCD Alliance, the McCabe Center for Law and Cancer, the Cancer City Challenge Foundation, and the ICCP, which is the International Cancer Control Portal. Our mission is to unite the cancer community, to reduce the global cancer burden, promote greater equity, and integrate cancer control into the World Health and Development Agenda. And I think it's very similar to most of the organizations represented today, including the ENSP, which focuses predominantly on tobacco control. Our work is divided into 3 large buckets. The first is convening, and we provide some very, very vibrant platforms for the entire cancer community to join forces and drive change on a global scale. And 3 of our flagship convening events are the World Cancer Day that we just finished on 4th February with the theme, I Can and I Will, the World Cancer Leaders Summit, and the World Cancer Congress, both of which are held every 2 years with a large number of participants. Say the World Cancer Congress would have close to 4,000, 3,000 to 4,000 participants. And the Leaders Summit, which is by invitation, goes across the globe to different continents, and the regional leaders with a topical theme all brought together under one roof, and we discuss and give direction to cancer control globally, but more importantly in that region. The second large bucket of our activities is capacity building, creating innovative tools and skills to help our organizations, our members, do a better job tomorrow than they already do today. These capacity building activities are focused a lot on local needs. We have leadership development programs where we target CEOs of major organizations, young leaders. We put together capacity building for peer-to-peer interaction at both the global and the regional level. We produce online education and resource material, various toolkits, webinars, training. And despite the pandemic, we've been very, very successful, both our partnership, advocacy, and our membership committee of holding all our members and beyond with these education and resource tools that we put. And then we've got grants for fellowships where they can go across for technology transfer, project improvement, workshops, or anything that is contributing to innovation. So that's the second bucket on capacity building. And third is our advocacy, where we integrate cancer control in the global health and developmental agenda, working across the policy cycle to help bring together evidence-based activities for cancer control. We engage countries, we engage with the WHO, civil society, our members, and various other agencies in our advocacy activities. And tobacco is something that is high up there on the agenda for advocacy. Now, what is the UICC's work in tobacco control? We've largely divided our efforts into four. That's connect, engage, raise awareness, and evidence-based advocacy. So what do we do in the connect people? We connect our partners and our networks, connecting the cancer community with the tobacco control community so that we can synergize efforts in our fight towards tobacco control. We build and we strengthen networks with health organizations and advocates, as well as with other UN agencies. So we connect our partners and our network. We give expertise, we connect experts to share resources, link to key holders, various organizations, government individuals, and develop capacity building in their efforts towards cancer control. And complementary, the UICC's goal and role is to bring new complementary knowledge on networks and partnerships. UICC makes efforts to facilitate and coordinate all these activities together. Evidence-based advocacy, what do we do in this? So apart from connection, what is our role in evidence-based advocacy? Reliability. There's knowledge sources have been clearly identified and gathered by a group of experts. They're peer-reviewed and based on scientific methods. So we give our evidence-based advocacy some sort of reliability. It's absolutely unbiased. The information is objective in order to develop an impartial and neutral knowledge. And its independence. The evidence and advocacy messaging has been developed and shared in an absolutely independent and transparent manner, free from any groups of interest and external influence. I'm just going to add one slide on one of the organizations that the UICC created, which is the McCabe Center for Law and Cancer. It's a joint initiative of the Cancer Control Council Victoria, the UICC, and the Cancer Council Australia. And basically what the McCabe Center for Law and Cancer does, through world-leading research and training program, it empowers individuals, organizations, and government to use law as an effective tool to prevent cancer and other NCTs. So this is a resource that's freely available to anybody across the globe who needs law to tackle tobacco control within their region. We raise awareness, and I think this is something that's so important in tobacco control. Websites, press and social media, peer-reviewed journals, the World Cancer Congress, the World Cancer Leaders Summit, the World Cancer Day, everything has a stamp of tobacco control. We involve our members and partners in relaying our messages. I said we have over 1,200 organizations and 17 partner organizations, a strong base to take our message on tobacco control. And policymakers, we spread the FCTC and WHO resolutions together with tobacco control messaging. We relay resources from networks, engage local stakeholders and advocates to reach policymakers, liaise with country missions in Geneva, and to involve member states at the global level. So we raise awareness through various activities at the UICC. The engagement and priorities in tobacco control, we support the FCTC measures through various activities. The tobacco control measures, we strongly advocate raising taxes, and I think that came out elegantly in the WHO presentation about 10% increase, decreases consumption by 3 to 5%, depends on which part of the world we are. We advocate smoke-free places, ban marketing to minors and young. We kind of negate the tobacco industry interference, counter misinformation of the public, impede to lobby government and decision makers, and report any dubious actions that we might note from the industry or from sources that counter the efforts of people. And we also now are focusing on novel and emerging tobacco products, and e-cigarettes is a case in point. In my part of the country, it's the smokeless tobacco, various heated tobaccos. In the Arab world, it's the hookahs and things like that. And bring evidence of these products and try to report marketing, targeting, where these marketing strategies are aimed at targeting youth. And as we all know, if you don't start when you're young, there's a 90% chance that you'll never take to this harmful effect of tobacco. I'm going to end with a few slides of an example and from a country, our country, that's India, to just give you all a flavor of what happens at our country. If you focus to the first panel on the left, you can see that about 42.4% of our countrymen are habituated to tobacco. And your tobacco consumption is divided among smokers and smokeless tobacco. For us, smokeless tobacco is a very big problem. And this is a problem not so much in Europe, in the EU, and in parts of the developed world, but in many parts of our region in Southeast Asia, smokeless tobacco it is quite a problem and significantly bigger than the smoked tobacco. As in the EU, and again, these figures came, we have young people who use tobacco in the age group of 13 to 15. You can see that nearly 19%, there's a large number of young boys who use the tobacco. And again, a large part of this tobacco consumption is in the form of the smokeless tobacco consumption. And exposure to secondhand smoke, both among youth and among adults, if you can see, is fairly high. I draw your attention to a recent publication from JAMA. I think it was 2 weeks back, looking at cancer registry data. And I was alarmed to see, while the majority, 90% of cancers are tobacco induced, about 12% are smokeless, but more importantly, a large part of the 90, nearly half of them are among past users. So people who've stopped. And again, I draw attention to both the previous presentations that very little is done on quitting tobacco. We do have other activities, and that's something that we must focus. As I say, even today, is very late to quit tobacco. And probably I urge, that's the message, that we must also focus on getting people to quit tobacco. And here are again figures from our country showing the problems with tobacco quitting. You can see the quit attempt currently among smokers is 38.5%, smokeless is 33%. Healthcare workers do advise smokers. Nearly half of them are advised, and smokeless, about a third of them are advised to quit smokers. But it's very, the success rate, as we know, is low. 16% of smokers, but the percentage of people who quit smokeless tobacco is still much lower. And that translates into a large number of head and neck cancers. Oral cancers, one of the biggest cancers. And when you see Globocan data, you don't see oral cancers in the top cancers. But if you see the cancer registry data from our country, you'll see that the majority of, in the top 5, you'll have oral cancers in both men and women. And that's predominantly because of the chewed tobacco. What do we do for cancer control and tobacco prevention? And I think if you focused on the left panel, I think the first essential step is to understand the determinants of tobacco consumption. That's very, very important. We'll have to look at low prices, gaps in the tobacco law, lack of political will, low or no taxes, the pressure from the tobacco industry, We'll have to look at the public surrogate ads that go out and, help or don't negate people starting tobacco. Socio-cultural factors, and in our part of the country, chewed tobacco is just accepted socially, and weak or no base on the sale to minors. We'll then have to engage the main stakeholders, that's government, cancer, tobacco control community, groups such as this who are present today, civil society, and even citizens play a very, very important role. We'll have to implement cost-effective and efficient measures. And I think this point will come out in all presentations. It's come out in the previous two about raising taxes, probably the single most effective method to decrease tobacco consumption. We'll have to make smoke-free areas, and we'll have to ban marketing to minors, work on the advertisements, plain packaging and pictorial warnings and various others. And that in itself will decrease cancer deaths and tobacco-associated diseases. And then if you look to the panel on the right, such preventive measures will increase people's health and wealth and relieve the burden on the health systems, and it will increase national and health and economic benefits. I end thanking you all once again for this platform to share the UICC work, a few of my own thoughts on tobacco control. I congratulate you all on your efforts. I thank Yannick and the rest of the advocacy group for helping me to put this presentation together. And I end with the message to people who are not so aware of the UICC or are aware and are not members. We'd love you to join us and help us in our fight on cancer control and other NCDs as well. So thank you, Cornell, once again for the opportunity, the organizer, and over back to you, Cornell.
Thank you very much. Thank you. And UICC was always a very serious partner in tobacco control. I remember at the beginning of my work in tobacco control, I had the possibility to use GlobalLink, a very important network managed by UICC at that time. And I hope maybe in the future, together with your team, somehow to reopen the communication network for tobacco control people around the world. It's something that we are missing now. Even if we have a lot of new technologies, Facebook, WhatsApp, we are missing our close communication network for tobacco control. And maybe UICC will come back with the support in this field. Thank you again, and have an excellent evening in India. And from India now we come back in Europe, and we go in the South Europe, in Greece, to Professor Panayotis Berakis, President of the ENSP Scientific Committee, former ENSP President, and a good friend and supporter of tobacco control activities in the ENSP network and in Europe in general. So, Panayotis, please, the floor is yours.
Thank you, Cornell. Thank you, Francisco, for inviting me to participate in the meeting of today. The purpose of my presentation is to talk about the role of science for tobacco control, and to refer in brief to the scientific activities of our organization, the ENSP, for tobacco control in Europe. But since everything is about the cancer, I'll start with my first slide, showing the map of cancer incidence in a global level. And just to make the point that North America, Europe, Australia, and Japan have the highest cancer incidence of the world. This clearly means that the developed countries suffer more than the other ones from cancer. this clearly means that cancer is a disease related with the development of our century. In the next slide, I have a picture of the cancer mortality, just to show that it is lung cancer, which is the leader cancer in mortality all over the world. In fact, it seems that tobacco plays the game here. And as Commissioner Kyriakides referred, it is very well established that almost 90% of lung cancer is due to tobacco use, smoking. So it is smoking the leading cancer mortality in global level. In the next slide, talking always about mortality, I can show you that in cancer, we can have a reduction of 41 mortality by stopping smoking. Talking about respiratory diseases, this reduction will be 63%, and talking about cardiovascular disease, the equivalent percentage is 25%. It seems that we, the people dealing with tobacco control, have a very important role to play in reducing mortality from cardiovascular, cancer, and respiratory diseases. In spite of these well-known scientific data, the smoking prevalence all over the world remains rather high. And in order to facilitate our view on smoking prevalence, allow me to present you a model showing that smoking prevalence is equivalent to the level of water in the vessel. A vessel with two taps, one filling it and one emptying it. And it is obvious that the level of the water in this vessel corresponds to the prevalence of smoking, and it has to do with the new smokers coming from the upper tap and the quitters referring to the lower tap. So the prevalence is a function of prevention and cessation, and these two are the targets of any program for tobacco control in a society. In the next slide, I'll come to the special role of science in improving prevention and cessation. Everybody's doing things against tobacco, but if we do not put research, education, communication, networking, and other elements like pricing, taxation, advocacy, legislation, if all these activities are not mixed with science, we cannot have effective results in prevention and cessation, which is the final target of what we are doing for tobacco control. And this is what we have been doing in the ENSP during the last 15 years. Next slide, please. The scientific approach of ENSP for tobacco control in Europe is within a frame defined by WebCTC protocol for illicit trade control, by the TPDs of European Union, and of course, by the global treaties on human rights. This is the frame defining and governing all the scientific activities of ENSP for tobacco control in Europe. And starting from the networking, I can show you that we have full members all over Europe, and we have associated members not only in Europe, but even in other countries. And of course, we have developed a special network of academic partners, as it is shown in this slide here. And we are trying to increase the number of academic partners because we know that this will increase the scientific power of our organization and the scientific output of our activities. We also participate in projects. Some of them are presented here. EURES Plus, TACACHES, Joint Action on Tobacco Control, EQUIPT, TOP-G, CIRNE, CIRNE-R, EPACT, and I'll refer to each one of them in a few words. EQUIPT program is a European study on quantifying utility of investment in protection from tobacco. The aim was to provide healthcare policymakers with bespoke information about economic and wider results, returns that can be generated by investing in evidence-based tobacco control, including smoking cessation agendas. The project was coordinated by Brunel University of London. The next. EURES Plus had as objective to monitor and evaluate the impact of TPD at an EU level. This was an ENSP project. The coordinator was the European Network for Smoking Prevention. CIRNE and the CIRNE-R were two projects coordinated by the University of Amsterdam, and both of them aimed to assess effectiveness of possible strategies to reduce inequalities in smoking. Next. TACACHES was a very important scientific project coordinated by the Institute of Oncologia Catalana from Spain, and it had to do with the second-hand tobacco smoke and e-cigarette emissions. The project was completed last year, end of October 19, and the ENSP was a very important partner of the whole work. TOP-G was another important and purely scientific project of ours. It was coordinated by Greece, and it had to do with the development of guidelines for tobacco cessation tailored to address the needs of specific high-risk groups like cardiovascular diseases, COPD, type 2 diabetes, adolescence, pregnancy, and it put the basis of an individualized process for tobacco control and for tobacco cessation, I would say. JATC is another Greece coordinated project. It ended last December. We are now preparing the final report on it. And of course, it had to do with a collaborative action between the European Commission and the EU member states to support TPD implementation through the EU member states and to improve the protection of the EU public health. ENSP organizes an annual meeting every year. And as far as I remember the function of our organization, in every annual meeting of ours, we have a special scientific meeting. The last four meetings of this kind took place in Brussels, in Bucharest, in Athens, in Madrid, and the most recent one, which was not in person, but through webinars, took place last October, if I remember well. And it included 8 webinars described here. I don't want to go through one by one, but it was clearly scientific, and a lot of papers were presented. So scientific discussions and presentations take place on a regular basis in every ENSP meeting for the last 15 years at least. Our publications include a series of books, mostly dedicated to tobacco dependence and to the treatment of tobacco dependence. This is a very successful scientific product of ENSP. It has been translated to more than 5 languages, and it has been circulating all over Europe in I don't know how many thousands of books. We are proud of this production, and I think that it is one of the best scientific products of ENSP. Of course, keep it back. Of course, we have our fact sheets, we have our journal, and we recently published The Ending of Tobacco Epidemic, an essential step for beating cancer. Next. We are also proud for our journal, the Tobacco Prevention and Cessation Journal, which is an open access peer-reviewed online journal. And it has to do with tobacco use and prevention, about policy implementation at a regional, national, or international level, to the disease development and progression related to tobacco use impact from the cellular to the international level, and to the treatment of tobacco-attributable disease through smoking cessation. The journal started in 2015, and here is a slide showing the increased number of submissions, the green bars, and the increased number of publications, the blue bars. You can see that it is in a function of growing interest and of growing number of publications. The downloads of the articles published in our journal are also increasing from 2015 to 2020, as it's shown by the green and the blue bars in this slide. And the journal is indexed in PubMed, Scopus, Google Scholar, Copernicus, and other international organizations. Of course, we have applied for Medline, and we are expecting good news soon. This is the scientific nucleus of ENSP, and this is how we are trying to serve the smoking prevention and cessation in Europe, and to try to develop methods and examples to be followed all over the world. Thank you for your attention.
Thank you very much, Professor Behakis. And yes, it's very important to know that ENSP is not just a small team in Brussels, the Secretariat in Brussels. It's a network. We are covering a lot of countries in Europe. We have a lot of good experts, a lot of scientists that are working in project. There are authors of, let's say, scientific articles, as you show. And yeah, this is our priority also in the future to keep the high level of the ENSP scientific work and involvement in this field. And now it's time for me to go back, let's say, home in Romania. And I'm very happy that today with us is our Romanian Minister of Health, Vlad Voiculescu. He is a strong supporter of tobacco control activities in Romania and Europe. And I'm very happy that he was able to join. It's not so easy for a minister now to participate to webinars with a lot of, let's say, problems created by the pandemic, by the health system, by the political scandals. So Vlad, thank you very much. And the floor is yours.
Thank you. Thank you for having me. And thank you for mentioning political scandals. We've had a couple of them over the last few years around here, but and we are struggling with the pandemic. But there's an older pandemic that we are all fighting, and that is the smoking pandemic. That's been killing more people than the number of victims we've had now with COVID-19 here in Romania, and it's doing that on a regular basis, if I may put it like that. I'm very happy to be here, and I also took some notes. Wanted to say that as the Minister of Health in Romania, I find myself in today's event in an intersection between two topics, actually, that I have been directly engaged in over the last few years, both very, very close to my heart. And that is cancer prevention and adequate policies to reduce tobacco consumption. And these are actually two of my key convictions as to how we as decision makers, but also we as citizens, can contribute to reduce the burden of diseases in Romania and indeed across the world. I'm particularly pleased, I must say, that I was a minister back in 2016 when, under the leadership of the presidential administration of Romania back then, we have been able to enable the civil society to bring forward the first, back then, tobacco endgame strategy by 2035. And I have had the opportunity to facilitate, and I have now the possibility to facilitate further achieving its key objectives. Now, the same objectives are actually the ones articulated by the European Commission in its recently launched Beating Cancer Plan. So my approach to the responsibility that comes with my mandate was and still is centered on securing the strength and the solidity of the public health system foundation structure. And we all know that all over the world, the healthcare systems need reforms, and they need it now, and they need to be profound, and they need to be long-lasting. And nothing can be built on a structure that is weakened, or under threats to collapse. So this is very much valid for our healthcare system, and indeed for our old healthcare system. And it is even more relevant, I would say, more valid when we're talking about prevention. Prevention represents that precise foundation of the structure that we want to build. And the burden of disease and suffering in Romania is huge, with around 92% of it being directly caused by non-communicable diseases. So this can be reversed only by a sustainable and strategic change in our approach of the healthcare system, and not only of the healthcare system, but of our healthcare policies as a whole. and especially by placing the needs to prevent before the cure as the top, the very top of on our priorities list. So we heard prevention being talked about in the past through a long series of beautiful words in political campaigns, that's for sure. And some shiny events and some long political or lengthy political speeches. What we need are decisive actions, and they must follow any political declaration. So my plan is to do exactly that. My plan is to place at the top of our priorities the need to reduce all those risk factors that impact the burden of disease and suffering in Romania. We need to reduce the impact of tobacco and alcohol consumption, and we need to tackle items such as obesity through diet and physical exercises. We have already taken the first steps in this regard, and we have probably the first governmental program that clearly articulates the specific policies to address risk factors and clear objectives to reduce their impact. And although I strongly believe that we all need a bit of magic when we're challenged with difficulties, I think the only magic needed to achieve these objectives relies on clear policies and clear actions. A particular emphasis I would like to put on a word, and that word, I hear people linking healthcare to lifestyle or choices, especially when talking about tobacco, alcohol, or some unhealthy diets. And as adult or even more as policymakers, we need first to change our individual approach to this. And the way we talk about health and determinants of health will actually make a difference, or will make the difference for our future generations. I think we are all responsible for that difference. And I will end by remembering what Tibi Ușeriu, I don't know if you've heard of him. He's one of the Romanian famous marathon runners that finished his last infernal race in the frozen lands, and he was assailed by questions afterwards. And, the questions were referring to how easy or how hard it was for him to achieve that. And his response was very simple, but memorable back then. He simply said, anyone can do easy things. So I'm confident that none of us is anyone, and that each individual will make a difference that we all want. So, quoting again what we all can, what you can hear frequently among communities working in cancer care, I think what we should aim for is to work together in replacing the I in illness to W in wellness. So I wish us all, I wish you and I wish us all success, and I would like to thank you on behalf of the Romanian government for your efforts, not only the current efforts, but the efforts that you've been doing for a couple of years now. And the success is tremendous, and it has saved lives here in Romania. Thank you once again for your collaboration, and I hope that our endeavors will contribute to healthier new generations. Thank you.
Thank you, Minister Voiculescu, and indeed, thank you also for your support for our members in Romania. And really, we have very, very strong members in Romania, and I hope that soon they will be able to support and to introduce new tobacco control laws, because still Romania needs to improve the tobacco control legislation in order to reach the high level of the FCTC and the directives implementation in Romania. Thank you very much, and we count on your support.
Thank you.
Yeah, so we are now at the end, but we can open a session of question and answers. We had some questions already. We answered in writing. We had some questions from Laurent Hubert. He asked about the European Union activities. So most probably the questions were directly addressed to Commissioner Kyriakides, but I tried to tell him that the European Union is it's constantly trying to improve the legislation in tobacco control, that we expect the new directives to be discussed and approved in the nearest future. And also we are expecting funds to be available under the new EU cancer plan to fund also tobacco control activities. So most probably new calls will be launched soon, March, April this year, also under the research program. In the chat, we had different discussions and you can all see the discussions in the chat. I will not repeat what is written here. What I will do, I will give back the floor to Francisco, to the ENSP president. And I kindly ask Francisco to conclude and to try to overview the today event with some impressions and maybe conclusions and future steps in our activity. Please, Francisco.
Thank you very much, Corinna. Thank you very much to all of you, to all the speakers. I think it has been very important to know the point of view of the Commission. I think it's the first time we are really seeing and hearing the Commission talking about this end game for tobacco in Europe. And to link that with the Europe-splitting cancer plan, I think is essential. I think it has been very clear that fighting tobacco, we can fight cancer and many of the aspects of cancer. I'm very happy having here also the representative of the patients. I've told in my first speech, and I'm really convinced that politicians are the responsibles of doing the laws, but politicians are working for the citizens, at the end for the patients. That's so clear. We must have always in mind, and we have count with patients when we describe, when we decide something. I think that's something very common in Brussels. I've seen it in Brussels many times, but not in different countries. In my country, it's not so easy to count with the patients, and I think this is essential. And well, I'm happy seeing, for me it has been very interesting to know Professor Cruz and to see all what they are doing from the International Union Against Cancer. I think they are very clear committed with tobacco control. I'm happy knowing that he's an oral surgeon, so he's really very concerned about the tobacco effects in the mouth. We have been talking about the lung. Of course, 90% of cancers in the lung are due to tobacco. But I'm also a dentist, I'm a physician, I'm working in oral cancer from a long time ago also. And I can tell you that probably without tobacco and alcohol, it will be very rare to see cancers in the mouth. So for me, it has been very important. Also, the point of view of the WHO, to have the lady from the WHO is essential for us. I think we must fight together. I think this is the way to do things. And of course, let me finish with the question from Laurent Hubert. I think it's very important to receive these funds because all these things must have some conclusion. I think the NGOs and the tobacco control activists are working very hard. We have a very mighty enemy, that is the tobacco industry, is the vector of this pandemic of tobacco that we are suffering, that leads to cancer in many occasions. And we need some help because sometimes we are working for free. We are doing the best we do and we have no resources. We have the truth. So I'm very confident in the results because they have money, we have the truth, but sometimes some money can help also us. So thank you very much to all of you. And I hope that this will be the start of a good communication, a good way of communication between the institutions, the politicians, the lawyers, I mean, who make the laws, that are the parliaments of the countries, the European institutions, and also the people that is working from the health aspect, from the patients, from the civil society. So I hope this will be a starting point, and I think I hope that we will be able to reach this end game for the tobacco in Europe in a close future. Thank you very much.
Thank you, Francisco. And just to answer to different requests, the today webinar will be posted on the ENSP YouTube channel. So it will be there probably tomorrow, and it can be distributed by everyone. So if any of the panelists or participants have additional questions, now it's time. Maybe Antonella, because I gave her the floor unexpected at the beginning. Maybe she has some more words to say, to tell us at the end.
Well, Cornelia, thanks. The only thing that I would like to stress compared to what has already been said is that, you know, cancer, tobacco smoke has a enormous impact on therapies, treatments management, not only for cancer patients, specifically for cancer patients, but not only. So it is very important for healthcare providers to acknowledge that smoking cessation is fundamental when a patient comes into the consultancy. So that is very important to acknowledge. And there are so many treatments that are impacted by smoking, by tobacco smoking, that it is unbelievable that there are still so many clinicians, so many healthcare providers that do not address the topic of smoking first and then smoking cessation with their patients. So that's all. Thanks, Cornel.
Thank you, Antonella. And just to add something more, Professor Berakis mentioned the ENSP activities in preparing guidelines for tobacco dependence treatments. The guidelines are addressed exactly to the medical people that you mentioned, the ones that, in our opinion, must discuss about tobacco consumption with their patients and to help them to quit. And just I wanted to say that Professor Berakis mentioned that the guidelines are available in more than 5 languages. I can tell you that are available in 18 languages. We just published the Arabic version. Very soon the Spanish version will be available. It's almost ready. We have Russian, English, French. So we need only Chinese, and we cover all the official UN languages with the ENSP language. And of course, a lot of languages in Europe, yeah. Romanian, Greek, Turkish, Albanian, okay, lot, Polish, Georgian, just to remember. So if we don't have any other question or comment.
Just a comment regarding these guidelines. I think, Cornel, is very interesting what you are saying. One of the things that I was shocked when I was hearing today the speakers was Professor Cruz, when was telling that the advice from the health professionals to the patients, it was only around 50–60% in India. Well, I think that's unacceptable. I think probably the health professionals need more support, need more education on tobacco prevention. That's essential, and I think we are, with these guidelines, we can help in that sense. I hope so. That's surprising for me in India, but it's not so surprising when you are traveling in Europe. Now you cannot travel, but in the past we were able to travel. And it was very surprising, the difference between different European countries. And that's something that we should solve as soon as possible. It's impressive for me that in some more advanced, let's say advanced countries in Europe, the physicians are very, very used to give advice on cancer, on tobacco to the patients, but not in others. And that's something very, very strange for me. That's something we must correct. That's something that is our mistake, it's our fault. We must correct that. I hope that at least from ENSP will help in this sense with the guidelines that now are available in very languages, will be online, will be absolutely free. And I think this will be would help for the sake of the patients, Antonella, but also for our interest. Because I think sometimes maybe the fault it has been that in the past in our curriculum, physicians were not so able to give this type of advice. That is not so difficult, very, very well organized. And I think this is a key message. So thank you to the Secretariat that is coordinating these guidelines. Thank you to the Scientific Committee. Thank you, Professor Berakis, because I think it's one of our best things done in the last time.
Yes, exactly. I remember 2011 when together with Professor Berakis, we created the editorial board and we published the first edition of the guidelines. And later also we published the e-learning platform. And then we organized face-to-face training courses in different countries in Europe. And last year we were forced to switch to online training sessions. We had very good training session in French in November. Very soon, now in March, maybe, or in April, we'll organize an online training session for doctors in Kazakhstan. By the way, the guidelines and the platform will be also available in Kazakh language. It will be the new language to be added soon. Yeah, so we're trying to do our best in the given conditions. Okay.
Thank you.
Professor Berakis, as former president and current president of the scientific committee, you have the floor to close this meeting, please.
Oh, thank you. Thank you. To me, it was a very interesting meeting, and I am somehow emotionally affected by participating in a tobacco control event after a few years being out of the many activities of ENSP. I always feel as a part of what we are doing in Europe for tobacco control. I'm very glad to help to assist in tobacco control in Europe. And I think that the meeting of today was a very important step relating tobacco control with cancer control in Europe. We all of us know that it is within the main targets of the new commissioner to fight cancer in Europe, and cancer is related with tobacco control, so it is a chain directly relating ENSP with commissioners and commissions plans for cancer control. The role of ENSP is becoming very important day by day, and I think that we have to play it very carefully, very effectively, and mostly scientifically. I think that this is the main message of today. ENSP is becoming a very strong factor, an agency in tobacco control, not only in Europe, but mainly in Europe and all over the world. This is why we had the participation of UICC, we had the participation of the WHO, and ENSP is becoming stronger and stronger, and we have to unite our power in fighting tobacco control in an organized way. And there is always space to improve the quality of our output. This is the message of the meeting of today. And thank you for inviting me to participate in it.
Thank you, Panayotis, and I will kindly ask all of you, panelists and participants, to stay with us for the next, let's say, 2 minutes to see a short video, and then I will close the Zoom session. So I wish you all health and a very nice evening. Just a second, I will start a nice, in fact, it's the ENSP brochure that you can see on our website, but it's in a different format. A second.
Cigarettes can kill you, and all you do is inhale and exhale.